In this video, we'll be talking about administration of suppository. What about it? It is one of the skill stations in your NMC OSCE, and there are key things which I'll be talking about towards the end of this video. I want you to stay tuned and watch this video till the end, because towards the end I'll be sharing some vital information which is key as touching this station. All right, so without further ado, let's dive directly into the video. As I approach my scene, I see my scene is safe, nothing to harm me or my patients. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7-step of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean. I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be looking after you today. How are you? All right. The reason why I'm here is doctor has ordered medication to be passed through your back passage, all right, to relieve you of your constipation. Is there a convenient time, please? All right, thank you very much. Before we continue, could you please confirm your full name, date of birth, while I double check with my paperwork as well as against your wristband, please? All right, so I have here Janet James. Janet James. Your date of birth is 01/01/1992. 01/01/1992. Your hospital number is 12345667. Your hospital number is 12345667. All right. Are you allergic to anything at all? It is properly documented in my chart that you are not allergic to anything. And also, that is why you are not on red wristband. Okay. All right. So I said so I can confirm I am with the right patient. Okay. So how may I address you, please? All right. Thank you very much. That's okay. Okay. So is it okay to take you through your chart, Janet? All right. So I have the medication record chart for Janet James. The date of birth 01/01/1992. The hospital number is 12345667. The height is 1.6 meter. The weight is 72 kilogram. The body mass index is not stated. The under prescriber's details. The prescriber name is Dr. Tolu. The GMC number is 1234. The signature is properly appended. The blip number is 123, and it is properly documented here under the details of the person administering the medication, which is me. I will come back to this part to enter my details correctly when I'm done administering the medication. Under alerts and allergies, my patient is not allergic to anything, and no non-allergy box is ticked for my patient. Under medication risk factors, there is no medication risk factor ticked for my patient. All right, I'm happy to proceed. I move on to the next page. I still have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as the previous. I have read and understood the code. I will make use of it appropriately if need be. Under once only medication. No once only medication is documented for my patients. I'm happy to move to the next page. On the next page, I have hospital match chart for Janet James. The date of birth 01/01/1992. The rest of information on this page is as the same as the previous. Under prescribed oxygen, Janet is not a non-CO2 retainer, and no oxygen is prescribed for Janet. I move on to antimicrobial. There is no antimicrobial prescribed for Janet. Under regular medicine, paracetamol is prescribed. The date is today. The dose is 1 gram. The frequency is 4 to 6 hourly. The route is per hora. The duration is left open. The start date is today. The finish date is not stated. The prescriber signature and blip is properly documented. The name of the doctor is Dr. Tolu, which is properly recorded. It's not due at my time, though it is a valid and legible prescription. All right, I move on to the next page. I have the hospital match chart for Janet James. The date of birth 01/01/1992. The rest of the information on this page is as the same as the previous. Under as required medicine, I have glycerin suppository. Under as required medicine, the first drug is glycerin suppository. The date is today, the dose is 1, the frequency is once, the route is per rectum, it's not stated, time is now, which is my time, 1200 hour. The start date is today. The finish date is not stated. The prescriber's signature and blip is properly documented. The doctor's name is Dr. Tolu. It is a valid and legible prescription. All right, and I'm happy to administer. All right, Janet, glycerin suppository is a medication that is used to relieve constipation. All right, some of the side effects you may or may not manifest include and not limited to diarrhea, abdominal discomfort, or dizziness. Are you still happy for me to administer? All right, so I'm not going to be signing this. I will come after I might have administered the medication to you. Checking for the next drug. There is no other medication that is prescribed under as required medicine. I move to the next page. I still have hospital match chart for Janet James. The date of birth is 01/01/1992. The rest of the information on this page is as the same as the previous page. Under infusion, there is no infusion prescribed for Janet. I move to omitted doses page. If I omit any medication and I need to sign this page, I'm going to come back and sign the page appropriately. Janet, here is the call bell. As I step aside to prepare your medication, do press on the call bell if you need me. So, leaving my patient bedside now, I'll go ahead and perform my hand hygiene, following the 7 steps of WHO standards. All right, so assessor, could you please confirm my equipment are clean and are ready for use? All right, thank you very much. On my hand, glycerin suppository. It is not expired. The expiration date is February 2026. I will go ahead and compare that with my prescription. I have also glycerin suppository prescribed. It correlates with my prescription and I'm happy to administer. I'll put that in my tray. I've worn my apron already, so I'll go ahead and pick a pair of gloves and keep that in my tray. All right, I have on my hand 2 pieces of gauze. It is not expired. The expiration date is February 2026. I am happy to use. I have here on my hand too the lubricant. The lubricant is not expired. The expiration date is February 2026. I'm happy to use. I put that in my tray. Also, I have on my hand an Inco pad. It is not expired. The expiration date is February 2026. I'm happy to use. I put that in my tray. All right, back to my patient now. I will go ahead and perform my hand hygiene, following the 7 steps of WHO standards. Then I'll wear my glove as I proceed to my patient. All right, Janet, I'm back. Are you still happy for us to continue, please? All right, so before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, so I still have Janet James. Janet James. All right, your hospital number is 01/01/1992. 01/01/1992. All right. Your hospital number is 1234567. Your 1234567. All right. And you said the other time that you are not allergic to anything. Am I correct? Okay, it's properly documented here that you are not allergic to anything. All right. So, assessor, I can still confirm I am with the right patient. All right, Janet, is it okay to assist you to lying down on your left lateral position, please? Okay, with your knees flexed towards your abdomen, your buttock towards the edge of the bed. Is that okay? While your feet is slightly raised. Is that all right with you? Okay, so I'll be exposing you minimally in order to assess where I'm going to be administering the medication, if that is okay with you. All right, thank you very much. I'm going to be placing an inco pad underneath you so that you don't get soiled, as well as the linen, if that is okay by you. All right, thank you. So I would want you to remain in this lying down position for 20 minutes or as long as you can no longer bear it. Would you be willing to do that? All right, thank you very much. So I will go ahead now to assess your perianal area before I administer the medication. I can see there is no rectal prolapse, no hemorrhoid, no infestation, no skin soreness, and there is no swelling. So I'm happy to proceed. I have on my hand the glycerin suppository. According to the manufacturer instruction, I'm going to be lubricating the apex. All right, some manufacturer instruction could be the blunt area is to be lubricated, but according to the manufacturer instruction, I'm going to be lubricating the apex. So I have on my hand a piece of gauze. I'm going to put an ample amount of lubricant on the gauze. I'll go ahead and lubricate the apex of the glycerin. Okay, I want you to take deep breathing breath for me, in and out, in and out, while I advance 2 to 4 centimeter in your rectum. Are you comfortable? Okay, so you may feel a little wetness around your perianal. Do not bother, it does mean that the medication is melting. Is that okay? So having inserted it, I will pick the second piece of gauze and wipe the excess from your perianal and provide privacy for you. All right, again. Okay, so I have there the commode. In case you want to use the commode, I will assist you and support you with pillows, all right, to make you comfortable. Or if you need to be accompanied to the toilet, I will also be here to assist you to the toilet. Is that okay? All right, so I will be stepping aside now to quickly document what I've administered to you. Is that okay? So I will be back in a moment. Right. So I'm going to take off my glove and apron or to the clinical waste bin, and I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, I'm back, Janet. Are you still comfortable? All right. So do you want to use the commode now or the toilet? Okay. All right. So whenever the need arises, do press on the call bell. That myself or any member of the team will be here to assist you to do that. Is that okay? All right. So I'll be leaving you now. Here is the call bell. Do make use of the call bell if you need us to come and assist you. So I'm going to be disposing every disposable articles and clean the reusable, prepare it for the next use, and perform my final hand hygiene following the 7 steps of WHO standard. All right, it's as simple as that. That brings us to the end of that station, suppository administration. The top tip here is do not forget to assist this patient, verbalize you will assist the patient to left lateral position, making sure their knees are flexed towards their abdomen and their legs, their feet are slightly raised. For the purpose of safety, do not move the mannequin. I repeat, do not move the mannequin during your examination. It could be critical. Yeah, because this medication will be administered on mannequin. Do not move the mannequin. Yeah. Another top tip is you need to verbalize you are checking the perianal region. It could be critical if this step is skipped. Also, do state you would want the patient to remain in lying down position for at least 20 minutes or as long as they cannot bear it again, right? Also, you need to verbalize you're going to lubricate the medication according to the manufacturer instruction to be on the safer side. The last top tip, which is key, is If this thing is not documented, it does mean you have not done it. Also, do remember to mention the 6 rights of medication. Suppository is also medication and it should be treated as so as you are doing implementation station. Alright, do it as so as you are doing implementation station. Carry your patients along in their chart. Tell them the indication of the medication, the likely side effects they are to expect. Allow them to give you a consent of whether or not the medication be administered. Thank you for watching. It is a new channel. Please do subscribe. Subscription is free. Drop lovely comments and drop the next OSCE station you would want me to treat, and I will try my best to do that. Until I see you in my subsequent videos, keep practicing OSCE.